Hi, I'm Mimi Secor, nurse practitioner, here live at the Meds meeting in Orlando, Florida with Joyce Ross, nurse practitioner and speaker. And Joyce, welcome.
Thank you. Welcome to you too.
I know you're giving some wonderful presentations today, and I heard you speak at our last meeting. I wondered if you'd talk about your dyslipidemia presentation and what you think is one of the most important take-home points.
Well, I think the most important thing, Mimi, is that 1 out of every 500 people in this country have a genetic disorder of hypercholesterolemia. The problem is it's undetected. You can't see it, you can't touch it, you can't taste it. Sometimes people are very thin, but they have high cholesterol because they got it from their parents.
Wow. So what do you think clinicians don't really appreciate about your subject?
I think that clinicians need to be a little more aggressive in looking at the lipids early on. When you look at a person who is supposed to have their cholesterol tested by 20, it's surprising in our country today that many people, and 30 and 40 years old, do not know what their lipid numbers are. And unfortunately, we know that for 40% of the population, the first idea that they had that they're high risk for the development of cardiovascular disease and high cholesterol was death. So death being the first symptom.
I always ask my young people that are in their 20s if they know what their cholesterol is, and most of them have no idea.
That's absolutely correct, and that's very frightening. And I think it's really up to our primary providers, as well as any other physician a person sees, whether it's a sports medicine doctor, whomever, making sure that our young people are tested. If you have a family member with very high cholesterol, and probably it's genetic, and what's really important is children then should be tested by age 2 years old.
Wow, that's a take-home message.
It's a major message out there. The National Lipid Association has presented a paper just recently on familial hypercholesterolemia and identification. We know today that if you identify a person even with very severe hypercholesterolemia and treat them aggressively, they have every chance of having the good lifestyle that anybody else has.
That's exciting. And what take-home message could we give clinicians for patient education about this subject?
Well, I think that there's so much information out there. You know, our patients are using the internet all the time today, and they understand that they can go and find good information. We know that the American Heart Association, the American College of Cardiology, the Familial Hypercholesterolemia Foundation, as well as the National Lipid Association and the Preventive Cardiology Nurses Association have tremendous amounts of information that's written at the patient level. And the idea is that if you have high cholesterol, making sure that you're educated well enough to know to get the rest of the people in your family tested.
Wow, great information. Thank you, Joyce,
Thank
for
you
joining
so
me
much.
this morning.